Good morning. How we doing today?
Could be better.
Okay, can I have your name and your date of birth?
My name's Mrs. Jones. I was born March 16th of 1928, thereabouts.
So the reason why I'm putting on gloves and the reason why I shut the door is to provide the patient with some privacy. And gloves are used to protect myself and the patient from spreading and capturing each other's germs. Alright, so I'm going to check your band gear, make sure that's alright. That's good to me. So I was told that you need your dentures taken care of and you need to use the restroom before we get your breakfast to you. Is that right?
Yes.
Alrighty, so I'm going to go ahead and take care of that for you. Don't mind. Just slide this in there. Okay. So I'm going to go ahead and take care of your dentures here. Don't mind. If you look closely, I took the top denture out by using my thumb and my pointer finger, broke the seal and pulled it out. And then I wiggled the bottom seal, got it out, put them in this bowl with a protective bottom, so I'll be careful not to break the dentures. Now once I'm in here, I take a washcloth, put it in the bottom of the sink in case I was to drop the dentures, and that's what happened to me. I use Trepid water, toothbrush, denture toothpaste on it. I'm using lids as my dentures. And I carefully brush the dentures. Now when you're brushing teeth, what you do is you hold the toothpaste at a 45-degree angle and brush your teeth. After the dentures are taken care of, put them in a moist holder for the denture patient. But since she's wanting these before her breakfast comes, we're going to go ahead and give these back to her and put these in for her. First, we have to ask if the patient wants any concrete or whatever it's called for the dentures, the glue that holds it in the mouth. Do you want any glue to hold your dentures in your mouth?
No, I believe I'll be all right.
All right, I gotta put these back in for you. Now, since the patient's ready to go and get her breakfast, we're gonna go ahead and deliver the tray. Okay, since her teeth are doing good and everything's ready to go, we're going to take care of the bedpan, and then we'll go ahead and grab her food so she can get her morning started. Reach underneath your gown here. We're going to lay the washcloth in the bath pan so it won't splash everywhere. Cover the patient back up. Now before we go get the patient's food, we need to do hand hygiene once again and change gloves. So we need necessary hand hygiene. Go ahead and slap us on some new gloves. patient is experiencing visual impairments, so we need to explain to her where her food is going to be. 12 o'clock we have your yogurt, 3 o'clock we have your fries, and over here 9 o'clock we have your pickles. Your silverware is to the left, and your water bottle is to the right. So since the patient is done with her food, we're going to go ahead and get started with her daily bed bath here. We shut the door to give her the most privacy and the most modesty, and the best way to start would be doing hand hygiene. And throw me on some new gloves. Now we've already verified the patient's identity this morning when I gave her her food. So I'm going to go ahead and start with taking the shower blanket and placing it over the patient. The shower blanket also provides privacy and modesty to the patient while we give her the bath. If you don't care, can you hold this for me? So I'm going to go ahead and take off the linens. So I'm going to go ahead and get started on getting her cleaned up. And it's always good to start from head to toe. Going from head to toe gets allows us to go from the cleanest to the dirtiest. Okay, raise up for me. We'll place a towel behind the patient's head. And place the pillow on a clean surface. So Ms. Jones, I'm gonna go ahead and start with washing your face. We'll start with the eyes, and we'll make a mitt out the wash rag. We go from inner and outer canthus. That prevents the bacteria going into the sinuses, the side of the eye. Go ahead and get the face. Use different corners. To get the different parts. At this part of the shower, it is good to ask the patient if it's a male. If due to cultural reasons, we ask if we need to shave them first, or if they want shaved. If not, we'll go ahead and discard this and the linen hamper, not the garbage. After that, we'll move on to the arms. So Ms. Jones, I'm gonna need for you to go ahead and give me your arms here. We'll place a towel long ways. This arm first. What we're gonna do now, get another washcloth, make another mitt. And we go distal to proximal. This also gives us the opportunity to go from dirtiest to clean. Clean to dirtiest, my bad. We do long, firm strokes. Make sure any incisions from any types of IVs are covered up, not to get wet. Gotta leave that there. And we'll get a dry washcloth. Go ahead and wipe them down from this point. Dry them off. Discard of this one. Do the same thing for the other side. Wipe them down with soap. Rinse the patient off, then dry them off. Now at this point, we start washing on the abdomen. Which I've already took the gown off, but I didn't mention that. But the necessary steps to take the gown off will be before you do the face. That's why we put the bath blanket on them. We take the IV through the gown, and then we pull the gown off. So what I do now is we bring this down so we can go ahead and get the abdomen. So what we do is we go ahead and start using long strokes from umbilical to the chest region. Make sure we get the patient good and clean. At this point, we need to go ahead and dry the patient off. And ask the patient if they need any deodorants or anything like that. Mrs. Jones, do you use any kind of deodorant?
Well, yes, I use Secret.
Okay.
Strong enough for a man.
We'll take our deodorant and go ahead. Give us a little bit to Mrs. Jones.
Thank you, young man.
Cover the patient back up, and we need to get started. Okay, at this point in the bed bath, it'd be smart to go ahead and change out the patient's water so they're not freezing to death during the bath. Okay, I went to the bathroom and changed out the patient's water. Ms. Jones, we're gonna go ahead and take care of your feet now and your legs. So we need to go ahead and get the leg farthest away from me exposed. We raise the leg, supporting it at the ankles. Slide the towel underneath it. Me. At this point, we take the washcloth, make the mitt out of it, put it in the soapy water, and go ahead and start washing our patient. We need to use long strokes but not firm on the legs, because if the patient has deep vein thrombosis, we do not want to move a clot. That could hurt the patient more than help. Go ahead and get to the thighs. We just cord over there. We take another mitt. We'll use the water and rinse them off. After we rinse them off, then we start drying them off. Usually pat dry. Now it's very important here to go ahead and take care of a little bit of the feet now. Don't want to get them too wet. We go ahead and pour a towel. Cover this side. Go over this side. Support at the ankle. Slide our towel. We follow the same steps as on the other side. Mitt, soap and water, long strokes, distal to proximal. Go ahead and get the thighs. Like I said, it's important this step to go ahead and start taking care of the feet and get prepared for the wash basin. Just quarter of our minutes. After we rinse them off, go ahead and start drying them off with a pat dry. And we move the towel. This next point, what we have to do is we need to change our gloves and perform hand hygiene once again. We're going to go ahead and get started on the back. The hand sanitizer solution makes these gloves really sticky on my hand. Okay, now at this point, when you start rolling the patient over so we can go ahead and get her back. Ms. Jones, I'm gonna roll you over so we can go ahead and get you back. And since the patient has a hip problem, what we need to do is provide her with a pillow in between her feet. So when she rolls over, she's not hurting her hip. Okay. We take it. Another towel, lay it long ways along the back. Take towel, cover up as best as we can. Same steps follow here. We take our mitt, soapy water, and we start long strokes, the best care for the patient. And also get the butt at this point. The outside edge of the butt, and the inside edge of the butt. Discard that linen. And after we rinse the patient off, because I'm running low on hand mitts here, to rinse the patient off, we'll take a dry one. We start drying the patient off. We don't want any moisture on the patient because moisture can produce skin breakdown. And we can roll the patient back over. Okay, so now it's time to start the peri-care of the client. The patient's a female, so we'll go ahead and start with female peri-care. Go ahead and discard our gloves. Perform the necessary hand hygiene. And put on our new gloves. We should go ahead and let the patient know what we want to do. Mrs. Jones, I'm gonna go ahead and start cleaning your vagina and your buttocks area. Is that okay with you?
Yes.
Okay, so step one is to make sure that the bath blanket, one corner's down here, one corner's up here, and the two corners are off to the side. We start with laying the towels between the patient's legs to protect the mattress and the bed coverings. We'll go ahead and expose you now. We need for you to raise your legs and separate them just a little bit. I'll place the towel. Go ahead and get started. So we go ahead and make our mitt. soapy water. How we do pericare for a female is we go external labia to the internal labia, pubic to rectum. So we go ahead and start one side of the external labia. We switch sides, get the other side. We discard of this one. We go ahead, get the internal labia. Go ahead and switch sides. Then we go pubic to rectum. After we rinse off the patient, we go ahead and take our dry cloth and go ahead and dry it up. Now, take a towel. Go ahead, place the pillow between the patient's legs and roll the patient over. This will allow us to go ahead and take care of the buttocks area. The pillow is put there to protect the patient since she has a hip injury. We start with the outside of the buttocks first using our soapy water. And then we go into the inside of the buttocks. After that, we rinse the patient off. Go ahead and dry our cloth, or dry cloth, and we wipe the patient down. Make sure they're dry. Good to go. We roll the patient back over. Retrieve our pillow. Patient back up. At this point, we're going to start with our foot care. So we're going to take our foot resin. We'll go ahead and start giving the patient a slight bend at the knee. Let them soak in the foot bath. It's also good at this point to go ahead and change out your gloves once again. Perform necessary hand hygiene while the patient's letting her feet soak for a minute. And go ahead and assist the patient back into their gown. So what I'm going to do, Mrs. Jones, I'm going to go ahead and assist you back into your gown. I'm going to drape your IV through first. So go ahead, take your IV, put it through your gown. And we'll go this side first. Put your gown through. Then we'll put your gown through on this side. And we'll tie you up back here. Okay, now what we do is you go ahead and get air mitt started. And we transfer this foot. Get a towel. Go ahead and start placing it at the patient's feet. Take our bowl and transfer to the other patient's foot. We start wiping down the patient's feet. This is a very important part in diabetics. Okay, we want to make sure we keep the toes We get those good and clean, and when it comes to drying them, we gotta make sure we dry very thoroughly in between the toes. If any moisture gets in there, bacteria will grow there, and the diabetic patient will be in a lot of trouble. Okay, so now, take this foot out. Go ahead and wipe this foot down after it's soaked for a couple minutes. And then we get a dry cloth, and we get a dry cloth, we dry them out. Make sure you get in between the toes. Then we remove our towel. Okay, so one of the key differences between taking care of a male and a female is the pericare. Obviously, a male has a penis and a female has a vagina. So the male differs quite a bit. For taking care of a male, you need to start with the inner thighs. And then you take thorough but careful washing around the scrotum and wash the shaft with long strokes, and then wash the tip of the penis, the glands. After you do that, if the patient is circumcised, obviously it's different than an uncircumcised patient. The uncircumcised patient has foreskin, so you need to retract the foreskin before you get to the glands. You need to take care of this. There could be a thing called smegma. That's a liquidy fluid that forms in the cheese. It's not real liquidy. It's more of it's a thicker fluid, but it's completely normal in uncircumcised males. Unless it has a really foul odor, then you need to be worried. But you always make sure to retract the foreskin back, because if not, the penis will swell. One of the things that our patient is not is she's not a male, but she's also not unconscious, and she also doesn't have teeth. I covered in the early part of the video how to take care of dentures. And then you put your washcloth in the bottom of the sink, you brush them with dental toothpaste, and store them in a moist container unless they need them. Then you put the glue to hold them in their mouth, and you go ahead and put them in their mouth. They need to rinse their mouth out after that. But an unconscious patient is different. An unconscious patient needs their mouth taken care of by the nurse. Reason for that is because you don't want to get the mouth too dry. Caring for an unconscious patient, you make sure that the bed has suction equipment nearby, because no fluid is supposed to go back down into the mouth. You take your toothpaste and you put it in on your toothbrush. You start brushing teeth at a 45-degree angle using a bite blocker or one of those popsicle sticks to examine the mouth. Once you brush your teeth, then you look for the mouth. Make sure it's not dry. Make sure liquids are coming back out, and make sure that the gums are all good and the patient's all good to go. Okay, Mrs. Jones, what we're going to do now is we're going to go ahead and take care of your hair, make you look all pretty. You need to do the hand hygiene. Go ahead and don gloves. Okay, first things first is taking a clean towel. Placing it. Raise your head up if you don't care. Placing it behind the patient's head on the pillow. Now, the next thing is we're going to go ahead and take out any ribbons or any holders or bobby pins that the patient has in their hair. She's a 92-year-old woman, so she doesn't really have any of those. But then we're going to make sure her hair's neat. She looks good to go. Go ahead and comb her hair. Give her a nice little side part here. She just had her hair cut. So after that, our patient is in good health for a 92-year-old woman. She actually doesn't have any hearing aids, but I'm going to discuss how to take care of those. First of all, you rotate them forward and pull them out. We turn them off, or turn the volume down and then turn them off. And then if the ear mold is detachable, the ear mold is detachable, then we can go ahead and clean the ear mold in soapy water. If not, we take a dry cloth and clean the hearing aid. Then we put it back in the patient's ear, rotate it backwards, and we turn on, and then let the patient set it themselves, or we try to help the patient set it themselves. But the reason why we do not keep the volume up and put it in the patient's ears, because we do not want to accidentally turn up and then the patient has hearing problems. So the next process would be to make the patient's bed in the morning. The actor that was acting like the patient had to leave, so I'm using a full body pillow, but I'm still gonna be able to get it done. It'd be necessary to do hand hygiene, which I've already done, but I'll do that again to show you guys. Better wash your hands. Grab 2 new gloves. And then you go ahead and convert those on. Now once you go ahead and get these things turned on, and the door is closed, so the patient is private. You can go ahead and let the patient know that we're going to go ahead and start placing your lens. Grab the shower blanket. Go ahead and cover them up so they have privacy. And we pull the lens down, keeping them covered. We grab the pillow. Pull the pillow from the pillowcase. Go ahead and lay the pillow on a clean surface. The pillow's on a clean surface. We get to the far side of the bed. And we'll go ahead and start pulling up the bed sheets. And rotating the patient, keeping her covered. And walking to the other side. Now on a hospital bed, we're going to have bed rails, so the bed rail would be raised on this side. We raise this side of the bed rail. Lower this side once we get over here. So we lower this side, go ahead and roll the patient over. We finish pulling the bed lens, keeping them away from us. Keeping them away from us to keep them still in our uniform. We don't get one near their secretions to get all over us, because we have to go see other patients, so we don't want to take their germs to the other patients. So we check carefully, make sure all the patient belongings are out of the bed while we roll it up. And then go ahead, put it in the hamper. Now, what we do, we go ahead, start on the far side again. Go ahead and put it the top half. Make sure that the middle point is the middle of the bed. And find the edge. And go ahead and start putting her under. So making her bed. Roll the patient over. At this point, we get a waterproof pad. So we grab our waterproof pad. In this case, I'm using a towel. Go ahead and start getting that started underneath the patient. Okay. Same rules apply with the handrails. This one's up. That one's lowered. So we raise that one and lower this one. Rotate the patient on this side. Go ahead. Start grabbing the floor of your sheets. Okay, now we can roll the patient back over. Now we lower that side. Now we raise that side and lower this side. This is for the top sheet. And the bedspread. We want the top of the bedspread to be about 6 inches from the top of the bed. Now we roll the patient over. And go ahead. Hold on, we don't roll the patient over. Do not roll the patient over at that point. Go ahead. Grab the other sides. Sheets first. And then the bedspread. At this point, I'll do a modified corner and toe pleat. Toe pleat. You raise the mattress. You slide your sheets up underneath. You take your sheets to a triangle. Okay? Everything from this side gets tucked in. Same roll applies on this side. Triangle. Everything back here gets tucked in. There's your corners. You take, this is when you should sanitize your pillow and let it dry. But I can't do that for my pillow. So take your pillowcase and your pillow. Miss Jones will go ahead and raise her head up. She's good to go. So a few key points to recap. First of all, when coming to a new patient, you need to perform necessary hand hygiene, and you need to check your patient's identity and verify that. You need to explain your topic or your procedure that you're going to be doing. In this case, it was a bed bath. In this particular case study, we had a female patient. So in the peri-care, it's always important to make sure that you take a hand and spread the external labia to get the internal labia when doing peri-care for the female patient, and making sure that it's dry down there because you don't want microbes to grow. Also, during the foot bath, you need to really make sure on those toes to make sure that the diabetic patient doesn't have microbes growing in their toes, in between their toes, because that can cause infections. You also need to clean underneath the fingernails and the toenails with the orange stick. This patient in particular was conscious. She had dentures. Always got to be gentle with the dentures. But because she had dentures, you need to inspect the gums. If the patient is unconscious, for example, you need to be careful with the teeth. You need to open up the mouth and make sure there's suction nearby. When doing suction, you need to inspect the mouth and the gums and the tongue. You don't want the tongue to get too dry, and you need to rub some kind of chapstick on the lips to make sure the lips don't get too dry. Brush teeth at a 45-degree angle, and use some. Well, if you floss, if the patient's unable to do mouth care for themselves, you need to get in between the teeth. Another important part that should be discussed about is when making a bed, whether it be occupied or unoccupied, before you leave the room, you always need to make sure that the call button's nearby. You don't want the patient getting up and falling. You want to make sure that they're accessible to ask for help. Especially in the case of a patient that has hip problems, she wouldn't necessarily be able to move like that, so you would need her to have her call out in case you need anything. Another important topic to discuss about is, in my video, I used a pillow to put in between the patient's legs when I rolled her over. The reason because of that, as we discussed in the lab practice sessions, was she had a hip problem. She had hip surgery. So she's not able to bear weight on her hips. You do not want her to end up injuring herself when you roll over. So we discussed putting a pillow in between her legs. So when you rolled her over, it wouldn't injure her. So I just thought those would be good things to recap on. Those are kind of important parts in my eyes: identifying your patient, making sure the peri-care was done correctly, making sure toes were done correctly, making sure the patient was cleaned, uninjured, assessed, and the call out was there in case they needed any